add as guest. All right, so Dr. Brown is being invited. People, hang on, and he's connecting. I see. There you go.
Hey,
Hi,
everybody, how you doing? This is the
friend.
first time I've done this. I've never do this in my
Big
practice.
up the friend. You should, but I see you do live videos, and you could add too. You could add.
I know, but I didn't know that you can connect with other
Yeah,
people
man.
and on their live broadcast. But hi, everybody, I'm Dr. Brown from Bermuda.
Hi, big up, Dr.
And yes,
Brown.
as Dr. Barbara said, yes, I do the P shot and the O shot all the time.
Thank you, and it worked.
And it works. So it's a procedure that we use the patient's body's ability to heal. So we take their platelets out of their blood, we spin it down in a special FDA-approved machine, and then we inject it in about 5 spots in the penis. And that may sound painful, but actually it's not, because we use a topical numbing cream that helps to make the treatment a little bit more palatable, I would say. But most importantly, I get men who say they can't aim and shoot, then after the procedure, they're able to do what they have to do, and they're quite pleased, and their wives are happy. I actually got a wife that called yesterday and booked an appointment for her husband, and he's coming in to get himself sorted out. So, there's no shame.
Nice.
You got to do what you got to do.
So let me ask you something, Dr. Brown. Where in the penis is it injected? Is it sub-Q? You use the same size needle as you would do the PRP for the face and the scalp? A 30 gauge?
No, I use a 27 gauge half-inch,
Okay.
or 1.5 inch, and it's 2 injections on either side of the corpus cavernosum,
Okay.
and then 1 injection at the head of the penis for sensitivity.
Okay, so how deep you go? Is sub-Q?
No, you go right into the corpus cavernosum muscle,
Okay.
and you inject sometimes 2.5 cc in each point, 1.5 to 2.5 cc in each point, depending on the person's size, and they take it and they tolerate it quite well, actually.
How let's see, how long does it last, the effect? Weeks, months?
The effect can last for quite some time, and what we do for like we say, penile rejuvenation,
Right.
we actually use the pump afterwards, all right? And that's very important because you want to be able to stretch and engorge the corpus cavernosum muscle in order to bring about one, length, increase girth and size, and to kind of rejuvenate those blood vessels, which the penis is a huge blood vessel. So you want to rejuvenate that using the penile pump that you use afterwards. So I give some guys some Viagra or Cialis afterwards, as well as the penile pump.
Okay.
They go ahead and use that for the next 2 weeks, at least once a day, and they're good. One of my patients, he used to go away to Johns Hopkins or one of these international centers to the urologist because he couldn't not get an erection whatsoever. Absolutely he had to use, what's his medications that they actually physically inject using a syringe. And that was the only way he was able to get an erection. And now, stop him. And now after the P shot, he was able to aim and shoot without problems. His lasted on a scale of 1 to 10 to about a 9 for about 6 months. And then it regressed to a 4 in reference to his overall erection hardness.
Mm-hmm.
And then I had him to use the penile pump a little bit more frequently, and it went back up to a 7, which is better than what he started, which was nothing.
Okay, so the penile pump, they could buy anywhere, right? Like Amazon sells them.
Yeah, they can buy them anywhere. We just happen to put it all a part of the package. So, in Bermuda, the stigma is I don't want to go and to the sex toy store because everyone knows everybody. So we go ahead and put in a bag for you.
So I can supply it then. The penile
yes,
pump,
exactly.
I've seen one. Do they come in different sizes? Small, medium, large, extra large?
They do, and some of them are motorized, some of them are automatic. Like we have this motorized one, so they just pretty much press the button and it creates the engorgement. And then you got the other ones which they have to physically pump. But for those people that are just joining us, we're talking about the P shot, and this is Vampire Month, and Dr. Barbara is also celebrating Vampire Month, which is all the blood treatments. And we're talking about the P shot for male erectile dysfunction. And not to leave the females out, but I know you do it as well, the O shot.
Right.
And I have ladies regaining their youth after this particular procedure. So this is actually completely painless for females. And I think 3 injections, you don't feel nothing. And afterwards, you can go ahead and notice that you have increased vaginal sensitivity, increased lubrication. Barbara, I did a lady, she was like 80 something, and she had a younger man. Yeah, she was. And she was like, listen, I don't know if I can say this on Facebook, but this is our Facebook Live page, so I can say it. She was so much, because she rides her moped, because Bermudians, we get around on mopeds, and she actually now has to wear a poised pad or something.
Right.
Because the sensation from the moped actually arouses her. And this is an 80-something-year-old woman that still wants to get happy. She actually just got remarried, and that's the reason why she had to find out
in her 80s.
This particular treatment. And it works, right? It also helped her urinary leakage. And after this procedure, Barbara, what we give them is a dildo, but we call it a medical device.
The vibrator.
Exactly. To stimulate and rejuvenate the whole area, and it works phenomenally. And so this is something that we're doing for the month of October here in Bermuda.
That's so nice. Anybody have any questions? I see people going live like crazy. They're on the stage.
This is so cool, but we got to do this more often.
You know, yes, I mean, because so many things, and then I watch your videos. I watch your live videos. What do you think about filler or to plump the outside of the vagina?
I saw that you did that.
Yes.
I'm going to have to look that up, but I'm sure it's, using Juvederm or one of these fillers will work quite easily in that area.
Right.
I've never done it personally, but it's something that I can definitely explore.
Okay.
Yeah,
so
because everyone's trying to get themselves sorted out.
Who just come on, men were asking me if there's any procedure for them, and it was one of my nursing colleagues who was interested in this field. She's in California, inboxed me, and she said, Barbara, you ever heard about this? I said, not really, and I went on and I looked, I said, oh yes, I do. So it's men, it's called the Priapus Shot, men, where your own blood platelets injected in your penis for sexual satisfaction and increased growth. All right. Who have on the phone is Dr. Brown. He's a physician in Bermuda, and he does it. And he also do the O shot for females too, for sexual pleasure. Okay. Can I recap again? I'm gonna share this video on my page so you guys could see it. All right, so big up to Dr. Brown. He's in Bermuda.
All right, darling. Well, it was nice joining you today, and this is the first time I've done this, so it's quite cool, but we do it again. I'm going to get back to the office.
When I'm doing anything, big up yourself and hope to come visit you one day, all right?
All right, look forward to it.
Yourself off. I think you can.